Actually, we have 8 separate residencies. Some are duly accredited by the AOA as well as the ACGME. And so we have residencies in family practice, internal medicine, surgery, emergency medicine, and pathology. And again, some of our programs are duly accredited. For example, family practice accepts both AOA, osteopathic as well as allopathic physicians. We've just recently applied for dual accreditation for our internal medicine program, which is currently ACGME accredited, but hopefully in the near future will be AOA accredited as well. Well, I tell people what the students tell me. So we take about 200 to 300 students a year from various medical students or various medical schools around the state and the country. And so what they tell us is that this is a fabulous opportunity for them to learn. We have high acuity patients. We have a lot of patients, and our faculty here are very interested in teaching. So what I would say is to tell them or encourage them to speak to some of our students who have rotated here. The experience is very, very good, and they're very interested. Our faculty are very interested in teaching. I would say with respect to the caliber, this is where they can come. This is an opportunity. So what we have most of, our greatest resources are our patients. And our patients come to us from all over the region. There's usually a fairly high acuity associated with them, and our staff is absolutely thrilled to be teaching. So as a teaching hospital with plenty of patients and low competition for learning behavior, learning activity, I tell people if they want a quality experience, they want the autonomy and the ability to grow and learn, I would say that they should look seriously at Memorial. Well, I think it's an extreme benefit as a community health center. These aren't ivory tower folks. All of our faculty members are practicing clinicians, and so they do what they teach, and so that's very important. So our students get to see firsthand not only what they're learning, but they're able to experience this patient care with their mentors. I think we have a better mix than most people realize. Most people would consider our institution unique. Most of the big city between Pittsburgh, Philadelphia, Harrisburg, it's kind of expected you'd find that kind of medicine there. However, most of our students are very surprised to see the actual acuity that we deal with and the actual amount of work that we do here. And so that's a real advantage when trying to teach somebody about caring for an acutely ill patient. It's about technology, I agree, but it's about the utilization of the technology or the appropriate utilization. And again, people are surprised to find out how technologically advanced we are. We've got a recent accreditation from the American College of Surgeons for our Medical Skills Learning Center, which is one of 56 in the entire world. And so, there's a real hats off to the folks that have developed this type of technology, and people are surprised to find it here in Johnstown. It's very important. Medical education has changed, and so, when we call it practicing medicine, this is an opportunity to practice and hone skills in a standardized fashion that would never harm a patient. And so we utilize this for all levels, not only our medical students, our residents, our nursing, our allied health. Everybody's involved in learning procedures and skills outside of patient care so that there's a standardized approach to each individual skill. And so the Medical Skills Lab has been a tremendous augmentation to the development of those clinical skills. Well, the length of accreditation is the hallmark of how qualified the program is to teach. And so we just received the highest accreditation in our institutional review. We're accredited for 5 years. Our family practice is accredited for the full 5 years. So when you're looking for a residency, you want to look at a quality program. And it's real easy to look and see what the duration of accreditation is. And here at Conemaugh, we're fully accredited and for the maximum period of time. I do. I think the commitment of the organization shines through. This organization has been committed to teaching for over 100 years now in their residency programs. And you can tell as you walk down the hall, people are interested in teaching, and we know that's part of our legacy here is to promote and to to maintain the highest possible quality of not only patient care, but also educational standards as well. I think if I'm a resident looking, or a medical student looking for a residency, I want to make sure that I'm going to a healthcare organization that's going to teach me the very best medicine that they could possibly teach. So as I look at health grades and see that there's nothing but quality going on here at Conemaugh, I'm assured to gain that type of an experience while I'm here. So yeah, I'm going to look at health grades as an important tool to determine where I'm going to go for my residency.